Thank you for the invitation. 80% winning rate, because every time I got a award, I called JP, VP, and he would say congratulations to me. But every time I got a rejection, I never called him.
That's 100%.
Yeah. Okay, today I'm very glad to be here and talking about how to get your first $250,000. But on the elevator, instead of $150,000, that's a little bit easier than $250,000. Yeah. But of course, we scientists, engineer, and biologists, everybody have an idea, and we want to make it into a business, and we are thinking to make a successful company. But the thing is, the reality is, we all need need money, need funding, and how much money is needed, and you need to think about that at the beginning. And I just plot the fund money versus the number of the year, and they said the first year have two people, and then 4, and then 8, and then say 15, and then 20 people. And each person's the burn rate for each person probably is $150,000 a year, because you need to overhead, the rent, the utility. So very quickly, over 5 years period, you require $5 to $7 million. Okay, and so you need to have that feeling about it's not only the first year, and of course that's the first step, you need to get through it. But then you always need to consider the second year and the following year, and because that's a business, you can run out the money, basically mean run out the business. And so how to get how to get the money? Okay, I think still it's based on the conventional way. You have the angel, you have the you have government grant, and you have VC, and you can get from the company. And I'm kind of go through that to share some of the experience I've been through and with you. The first one is the angel. Angel is I think it's the easiest one. However, the pro, you can make your friend rich. That sounds very good. The con is you can lose your friend or you lose your relative. That's a tremendous pressure on you. I'm so afraid to take money from my relative, from my friend. What happens if I fail? That is really difficult to take that money. But last year, 2 years ago, I have my brother-in-law, and he told me, I've been put the money into the stock, the high-risk stock or startup stock, and that is very risky too. Easily go from the $1 stock can go to become 10 cents. It can be very easy to go to 10 cents. You lose 90% of money very easily, and because I know you for so many years, and I trust you, so I think I betting on you is to have a more chance than this high risk stock. And so he told me that, and I said, that's right. Are you confident your business likely will be successful? You need to think about that. And you think really your business can be very successful, you may have better chance to land that the kind of the small cap, the stock may be better than that. And so you think that way,
later.
I think you think that way. I think it's okay to take their money because you think your business will be likely successful, and they really have confidence. So the thing is, you need to take their money. Let them feel, you need to be both mutually needs to be comfortable. You feel it's okay, I take them money, and they feel, they are comfortable in you. But you need to tell them the risk, let them know the risk too. You cannot just put a very beautiful picture for them. So you need to tell them, the risk. So they need to understand, because most of your relative friends don't understand about your technology, don't understand your business. So needs to let them feel comfortable, let them understand the risk. And of course, they need to trust you, and you need to make a commitment now, once you take the money. So you really need to take commitment, Sometimes, you basically, you put your sweat equity into the company, you work for free, and you have that kind of commitment. Then you take 5 friends or five relatives, then you can get to $250,000. That's what I feel. Yeah. So so you need to evaluate your friend or relative, their financial situation. If they are, putting the money into this the high risk stuff, I think it's okay. I feel my company have a low risk than that. Then I think it's okay. But then, of course, you need to think about how you repay to your investor. These are the early investor, but you need to think, well, how I'm going to repay them. And the first is, of course, how much your idea was, how you value your idea. Just an idea, you have nothing yet. So you can say, $5 million, $1 million, $5 million. But is that true? Is that real? Have that much money? Because people always have a lots of idea, but idea does not mean anything at all. Idea needs to put through test and make it into a product, and to make have a value. So idea is people come out with the idea all the time. So the thing is idea maybe $1.5 million to $2 million. And so you get the $250,000. So that's equal to about 15 to 35%. Of the equity needs to give to them. And so that's actually the big chunk of the 35%, 30%. That's a large amount of the money from the company. Yeah. And of course, second is SBIR government. That is a very good good way, because it's non-dilutive, and so you don't need to lose your equity. However, the SBIR, the process is very slow, and you may lose in the window the opportunity for both business and the technology. So that's the pro and con. And you need to know your art. Typically it's 15%, 10% to 35%. And so 10% means you need to write 10 proposals in order to win one. And 35% means you need to you can write 3 and get 1. Okay, so you need to know the art of winning. And of course, this is always related to quality and the quantity. And we all love to write a high quality proposal, but unfortunately, always the winning proposal always have a quality time luck. You still get the luck. It always depends on luck, because it's depends on have 3 reviewers, but it's only actually the first reviewer is the most important one. So it depends on one single person, and he like it or not. It depends on him. And so it depends on luck. That's still a lot of depend on luck. So sometimes it's the statistical work. It's a statistical work. That's what I mean is you win in and raise 10%, then you write 10, then you're going to get 1. You write 20, I think you're going to get 2. Really, that's true. Really is true. Statistical work, And so depending on how many you're going to win. I'm going to win 3 this year, so I need to write 30. That's the reality. So it's not easy. It's not easy to write so many proposals, of course. But the thing is, they work. And so the SBI right now is 100,000. I'm talking about NIH. Of course, the total SBIR program is about $2.5 billion per year from DOD, NSF, NIH, DOE. And the NIH is about $650 million a year. And the phase one is $100,000. You can write up to $300,000. Then that's okay. Although they say $100,000, you can write $300,000. It's no problem. For non-SBIR, sometimes it's $500,000 to $1 million. So it's lots of the government funding there. And I think that with this group of people, you are all excellent in technology. And so I think you have a chance to win this. And yeah, just share with you about how to win SBIR, because I certainly, I read that for the past 15 years. And so the thing is, I always tell the new writer to say, to think about this way. The reviewer, they read your proposal like reading a newspaper, and the first couple of pages, that's the most important one. If they don't like it, and they already reject you, and the reviewer's responsibility to find a reason not to like you. That's their responsibility. Then they are not trying to find a reason to like your proposal. They're trying to find a reason not to like you. Then immediately they write down a rejection, and then they are done with that proposal. So the thing is, the first couple pages, if they don't like it, you are history. And so the thing is, the first 2 pages basically abstract. Start with title. Title of the proposal is already very important. You need to, have the technology and what it's used for, and the application and your technology needs to both on the title. And then of course the abstract, and then the first page, how significant it is. And so the thing is that's very important. So significant, what I mean is, what means significant? My system will be improve 50% efficiency. That's not significant enough. When I say 100 times, it's 104. It's 10,000% better than current technology. That's 100 times better. What I mean 100 times better in terms of what? Can be in terms of the price, can be the cost, can be in terms of the response time, can be in terms of sensitivity, or in terms of specificity. Anything needs to be significant enough. 100 times better. That's what they're looking for. Or something current technology cannot do. Of course, you are better. Right now I have nothing, no technology. So you are offering a new technology, nothing can do. So that is the significant. So you can work on something current method cannot do. Certain disease, current it's no method. It's no cure for this disease. That is really the significant part. Innovativeness. The most of NIH reviewer is professor. I think there were lots of professors here. And when the professors hear about some technology 2 years ago or 3 years ago, immediately for them, that's not innovativeness anymore. Even sometimes no product yet, but sometimes they become, it's not new to them, anymore. And so, because you need to know the reviewer are all most of them, 80% are professors, and they read lots of the journal article, and so they know all the current state of art technology, and so you want make them to feel excited about your technology, and so if a few years old, they become not new anymore. And I think the investigator or team, you need to have a good team. At least probably needs to have like three PhD, and needs to be exactly in that field. The proposal you are writing, needs to be in that field. And sometimes if you involve with the NIH, it's better to have the clinician. They know what they want. And so that is very important to also have a medical doctor, and in that particular field. And then of course is the approach. Approach is the task. You just step by step, write on the task. But I think the most important part is still you need to do it. Lots of people ask me, say they want to write proposal, but then they never write it, and because it really needs to execute it, write it, and that's the only way to win it. Yeah. Okay, the commercialization process it's very, it's a very long process. Marketing, and you do some market research, and then you find the idea, and then you write proposal. You got funding, you got the technical feasibility, and you provide submit the patent, and then you write another phase 2 proposal, get more funding, and then make a prototype, and then do market analysis, and then the business plan, and making the pre-production unit, and then pilot production, then mass production, and then go to FDA and become a viable product. So it's a very long process, and so you need to understand all this process. And of course you can act it anytime. If I'm very good at the idea, I can write a patent and then act it. I sell the IP to other company. It's okay too. So you don't need to go all the way to the final product. You want to focus on certain area, go to the IP and then sell the product. That's okay too. So think about that. There are many strategies. I think my slide messed it up. Yeah, that's what I'm talking about. Okay, we see typically they are funding like more than $1 million because they need to do due diligence, and so they need to spend lots of time with you. So you just less than $1 million, sometimes they are not that interested. But if it's more than $1 million, and sometimes for the early stage, the early stage VC, they also like to give you small money to demonstrate the feasibility. My experience on the VC is I have a high school friend, and he's a biologist, and he understands my technology, and then he asked his brother, he's a VC, to invest in me. So that is the connection and the champion, and that's very important. Because not many people understand the technology, and so unless have a champion, he really push. It's very difficult to go through. You need both champion and connection. And for example, like VC, lots of VC company, they don't understand about your technology. They are afraid to make a mistake, so they will not invest in your company because they don't understand. And so needs to have a lead investor. The investor is very difficult to find, and because they need to understand you and trust you and understand your technology, and they have a connection to the VC, So that's the but it's possible the VC also invest in some startup company. Of course, you can have a broker, broker. You give them a broker fee, but then sometimes some broker only want to take the funding from you. You need to give them $20,000, and after after six months they give no result. So I would prefer maybe give them $5,000, $10,000, and then give them stock. Give them 50,000 share of the stock or something like that, and then maybe so ask them to work hard for to get the funding. You also can get a funding from the company. Our experience is we have technology, and we license to the company in a particular field of the use and the particular territory. Let's say only for the infectious disease testing, only for the Asian area, or for the Europe area. And so you can have a license or to the distributor too. So you can slice your pie to several portions, and then give up to some company, and so the company actually is also good source to get a funding, because they know your product and very well, and they can sell your product or use your product, and so you need, so it's also possible to get a funding from the company. Of course, you always need to have an IP. Okay, yeah, IP is very important. Otherwise, they are afraid they will be being sued. Yeah, so you can get the licensing fee from payment, $100,000 to $500,000, and they let you keep developing. Okay, main reason to fail 90% technology doesn't work. It's really true. It's a technology. Many of the technology are too innovative and very very difficult to make it work. And so as a startup company, and you need to really evaluate your technology, really make sure it will work. And 90% will run out of money, because as I said, this is a long process. You may need $5-7 million, and during that process, you run out of money, and so you cannot continue. And 90% of the product is not commercially viable. What I mean is, you make a product. Actually, our company too. We make a product. We saw about 30 units per year. We bring in a revenue about $300,000 a year. But we spend $500,000 to make $300,000, and the year is always like that. After 5 years, we lose more money than the more we sell the product, the more we lose the money, and so it's not viable, and so we need to discontinue that. So that's also happen quite often. So that's the hard part. Yeah. So this is the final note. Yeah, I think that when entrepreneurs start a company, it still is the market need. Should be the market driven, not the technology driven. And talk to customer. We all know that. Talk to customer. But really, how many entrepreneurs really talk to how many customers? I think at least you should talk to 10 customers. But most of them talk to 3 or 4 people, and then they get an idea, and then they start something. Actually, at least you should talk to 10 customers. Really, the potential buyer. Not just the some secondary customer or something like that. Really have a potential to buy your product, and so that's still very very important. Engineer always we all tend to be working on the technology instead of the market. Yeah, and it's a long journey. And it's exciting, and can be very satisfaction when you make something to a product that feel really good, and sometimes can be rewarded too. And my final note is certainly go for it, and but needs to do it because I try so many years, and I fail so many times, but yeah, I still very excited. Thank you.
Any questions?
I have one. Where can we find grants like yours that were approved, so we can look at them to see
The sample.
the successful ones, right?
I think some NIH or something, they have a sample too, yeah, and they have the proposal being funded, they have some kind of sample.
On their website?
Yeah, yeah, and I don't know, you can, I think GP probably also have some.
I think it's an NIH website, how we can download the abstract of the funded proposal, but not the entire proposal.
Right, because the proprietary.
Right.
Yeah.
Because sometimes in the proposal they have proprietary information and also IP embedded in the writing, so they don't disclose that.
Right.
Yeah. Yeah.
Is there ever a point where they do, like eventually?
I think it's usually
Once it's something.
for a company they don't do that. For university we do. We post our proposal on the web sometimes.
Oh, really?
Yeah.
Where is that at?
So it depends on faculty. Sometimes you visit a different website and, for example, some of the major center grant, they post their proposal on the web.
Yeah, the SBI is SBIR.gov, right? Yeah, I think that's the website, with all the information. Yeah.
Maybe I can make a comment on that question. Technically, you can ask for anybody's proposal if it's federally funded through the Freedom of Information Act, and they can delete the confidential part, but they have to release that proposal to you if they use public money, right? And I know examples personally.
That's good to know.
Yeah.
Yeah, that's true. We've been requested that too. Yeah. Yeah.
In your angel funding section, you talked about valuing the company. Are you valuing the IP or the cash flow that you're making in the next couple of years?
Yeah, that's in fact it's very difficult. I have worked at a company, and before I asked the professional, they come to evaluate the company, and end up they say it's $500,000 to $4 million. And so he asked me, how much you want? What you want your company to be valued. So it's early stage. It's very difficult. Depending on IP can be can be very difficult, because at the early stage you don't have a revenue, and the revenue does not mean anything either. And so it's very much dependent on the IP, and so IP can it's very difficult to value that. Yeah.
Did you have to write business plans? And if you did, where did you learn to do this?
Oh, that's been criticized and criticized so many times. Yeah, yeah. We have the business plan. It's also the same thing. It needs to be short and sweet. And executive summary, it's the 2-page. You need to put everything in that 2-page. And but yeah, I think there are many. Probably some book talking about that, but it's
SBA has a template,
yeah.
things like that.
I've been
See
working
those?
on it.
Okay,
It's a lot.
Yeah. But some investors just like the nuts and bolts, show me the numbers.
Right.
So
Yeah.
I'm doing 2 plans, I got the marketing verbose stuff, to make people feel confident, but then also reality.
Yeah, it's good for you to go through the process, and you understand, keep thinking about the next 5 years. Yeah, so that's, yeah.
Any other questions?
Sorry, one more.
Yeah.
So, for all the different categories of funding that you get, what do they expect in terms of ownership of the company? Do they expect you to give up like 50% of the company for $250,000, or?
Well, so it always depends on the timing, the time you are requested for funding. And so right now, at the beginning, let's say it's a company, you're thinking $1 million, and so you get $250,000, and then you need to give 25%. But after that, then you making you demonstrate your feasibility, then your company maybe become $3 million now. Okay, your company value becomes $3 million. So right now, okay, you asking for $1 million, then you give 30%. So the thing is, you always trying to make your company have more value before you asking for the fund. Yeah. So it always needs to go through several steps. So that's the reason have a series A, B, C, D, E, before IPO, and so but the investor like the company value keep increase. Yeah. So for the owner, the funder, your percentage becomes smaller and smaller and smaller. Yeah. So of course you hope the pie become bigger and bigger and bigger. Yeah. So that's yeah. Sometimes the pie become double, but your ownership become 50%. That happen all the time. You work 2 years, and then the pie become bigger, but your ownership become 50%. Yeah. So yeah, and sometimes it can be go the other way too. when the company is going nowhere, after 5 years, after 6 years, and you are not going nowhere. Before it's $3 per share. Now nobody want to fund you anymore. Then you say, okay, 50 cents per share.
You own 100% of the debt.
Yeah. And all your previous investor will be really mad at you. But that's the reality. Yeah. Yeah.
Okay. Looks like I have to go.
Yeah.
Let's
Okay.
thank Dr.
Thank you.
Thank you very much.
So now it's a pleasure to have Professor Feng Zhang to talk about his
It's a very different perspective. You guys hear me okay? Yeah. So I'll probably just stand here talking to you instead of using microphone. I'm a professor here at the UC Irvine. Right? I don't run a business, or that will get me into trouble. Right? So I think the perspective is very different. But I'll tell you, some personal experience, right? So you can see how a professor started. I co-founded his company and tried to make those companies commercially successful. That's very important. Before telling the 3 companies that I've been involved in, maybe I'll tell you a failure that was before all of these. Right? Was about 1993, after my PhD and 3-year postdoc, and I was at the House Year Institute in Los Angeles. And at that time, I work in a medical device called a cochlear implant. It's a medical device that help deaf people restore partial hearing. That's a wonderful product. Right? There's only one company making that at that point in Australia. And Almen, one of the biomedical device or most successful biomedical entrepreneur in the country, right? And he decided to start a cochlear implant company. Right? And so I said, well, we know how to do this. People from UCSF and from House here at Stanford, they're the pioneers in research and development. Right? And so we formed a kind of collaborative collaboration between House Here Institute and Advanced Bionics. And my idea was, I said, well, if we want to make this really low cost so more people can afford it, best way, maybe we should go to China. Maybe a little too early at that time. But we had a joint project between House Year Institute and Advanced Bionics. And we got maybe $400K per year, a little more. I wrote the proposal, and I was the project manager to develop a low-cost cochlear implant between these 2 institutions. So if you look at my resume, between about 93, 98 or so, my scientific production probably halved, because I did spend 50% of my time as the program manager, to oversee development of that particular low-cost cochlear implant. So we had a prototype ready in '96 and a couple of patents, right? I even went to find a pacemaker company in China trying to transfer that technology from US to China so we can make that cochlear implant in China cost-effective ways. And a lot of things going on at that time. And make a long story short, right, that Advanced Bionics said, no, we just want to shelve this. We do not want to transfer that technology to that pacemaker company in China. So that's pretty much the end of it. And I worked very hard, right, try to convince both parties to go for it. And that made me learn a very valuable lesson. I think the lesson is when you go into something, you need some independence. Right? If you don't have that independence, right, I think a lot of it means control, right? And it's very likely, right? Particularly the shareholders, right? If they have different visions, right? I think it's not going to be successful. I mean, that's, I think, very important for me. Well, whoever you partner with, you better make sure, right, you share the same vision, Otherwise, it's not going to be successful at all, right? And and I said, well, this is not really a place for me. I decided to leave House Institute, and here I am at UCI. And then I said, well, what I like to do, maybe start something, maybe from scratch. We look at the current devices, technology. See, the other thing is you have to be really strong in what you're doing. And by that, I mean you have to be a leader in your own field. I mean, if you want to be successful in the long run, particularly for us, right, researchers on campus, why do other guys who have money to want to work with you? Well, they want to find the leaders, the successful guys in the field, and that they can build on that success, right, and to commercialize it. And for us, well, we need the resources, we want the money, and we can make something or translate the things we do in the lab into something useful in the market, right? So we developed some technologies to advance, the signal processing, in particular in cochlear implants. And in particular, what we did was the previous cochlear implants, they didn't do a good job in terms of letting the users understand music or tonal languages such as Mandarin, Vietnamese, right, Thai in Asia. You think about, if a device that doesn't really carry a very important aspect of language, I say in Chinese market, well, if we have some unique advantage over that, well, that sounds pretty good, right? So we developed that technology. We filed, I saw some Grace and his colleague there, right? So we submitted our ROI to Tech Transfer Office, right? And then, of course, my intention, because of the failure, and I said, this time, let's try to find investors. I don't know how many people or groups I've talked to. I bet probably 30, 40, even 50. And, through all kinds of channels, right? Personal connections, right? Friends, and the Technology Alliance office sent a bunch of people. I went to so many those Octan or Los Angeles, New York, those inventor kind of forum things, right, to pitch the idea. This is a wonderful technology. We talked to a lot of people, right? And in the end, the three groups, they express very sincere interest in developing or bringing this technology to a product, right? And there's one group based in Irvine, and another group in Hong Kong, and a third group is a sort of a joint venture between a Canadian business person and a real estate tycoon in China, right? And I ideally, would like to work with somebody locally, who has medical device experience, right? And to give us a reasonable offer. And but I chatted and look at their background and their interest, and finally, with help with the Technology Transfer Office, and I selected the group from China and Canada. And the reason for that was simple. Remember, I said you got to really share the same vision, right? Even though these investors I selected didn't have medical device experience, but they share the vision. The vision is, this is a new field, we're willing to learn, and we have enough resources, and we really want to make this happen. And what sold me is what the lead investor said. He said, hey, Fang Gan, I asked for $3 million, and I said, just have a startup in Irvine, we can make a prototype, right? And he said, if it works, great. If it doesn't work, right, I'm not going to kill myself or kill or you, right? And just call it a great experiment, right? And some of you guys, met him, so that's how we made that deal. We took 9 months to negotiate with the UC and Regents to, finalize the tech transfer license and agreement, right? With the $3 million, we have startup in Spectrum, right? And we made a prototype after 3 years. We started like 2005. 2008. If you have a computer, let me see, is it connected to internet?
Yes.
Yeah, if you can go to neurotron.com, you can see the website. I'll show you, what kind of product we actually made, right? So we made a prototype in about 3 years, and we look pretty good, and reached whatever specifications we designed, and then the investors invested another $7 million and to build a manufacturing facility in China. Right? And now, there's 60 people in China, 10 people in Irvine, and we just finished the human clinical trial. We implanted 60 patients in China, and the longest person has been performing very well with our device for about a year. And even though, as I said, we haven't sold any product yet, it's still under review. Many of them in Chinese. Did you click on these?
It doesn't have the language pack installed, so it just shows the squares.
Oh, maybe I'll just type in. Because the initial market, was mostly the Chinese market, the way I see it. That's some of the patients that who have received our device and are doing very well. We look at it as the initial trial from 60 patients, and they are doing as well, or in some cases better than the current devices in the market. I'm not going to talk about it too much about the details, regarding the product. It's an implantable medical device. It requires a lot of technology. But I think the other thing I learned from the failure I had, remember, business-wise, right? We didn't make the first generation product into a commercially available device. However, remember, the expertise you gained, the connections you made, and they prove so valuable to what I'm doing now, right? At that time, for people who follow medical device development, right? Advanced Bionics was sold to Boston Scientific, right? Around 2005 or 6, there's a lot of turmoil within the company, and Advanced Bionics let a lot of guys go, some of their best technical people, and this is we truly took advantage of that situation. Like their vice president for research and development, came to work for us. Of course, we'll have to be very careful not violating any intellectual properties. But of course, the know-how, the knowledge, you don't have to make the sort of same mistakes. Even talk to the right vendors, for example, things along those lines, right? And now with the Neurotron, I'm the chair of the scientific advisory board, and with this, I know what this company will do. Now we're talking to institutional investors. Even though, as I said, we haven't made a single penny revenue, but we got a lot of attention from the institutional investors. I was very surprised. Just last week, I talked to guys from the city. They come to find us. Right? Say, hey, we're interested in this. I said, why? Well, remember, the medical device so far has been very interesting business. It is a high profit margin, very high profit margin, right? Any medical device, right? Very expensive. And all these big companies, Medtronic, GNJ, St. Jude's, right? They enjoy that high profit margin, even though their customer base, right, may not be wide. So we said we have very high priced product. Only a small portion of people can benefit from it. To me, for guys from academia, that's against the basic philosophy we said you have a good technology. We want everybody who can benefit from this, can access to it, right? And I think with a company like that, this is the first time a Class 3 implantable device being manufactured in a developing country, right? And I'm very hopeful, right? This will be the first device the FDA will approve, right? Made in a developing country. If you look at, there's no Class 3 implantable device made outside of developed countries, right? Now, what I told these institutional investors, I said, look, I mean, you guys have been traditionally supporting, the current business model, right? But I think if not us, I can see a wave, right, coming in medical device company. They're going to break this old business model, right? And this medical device will be made in developing country, serving not only patients in developing countries, but also patients here in the United States, in Europe. And why? Think about it, for the device that we're making, right, the manufacturer's outdoor price is about $25,000 US. We sell that to our hospital. Hospital typically have a markup, right? UCI maybe $5,000 markup. If you go to private place like Hopkins, Stanford, or House here, the markup can be 2-3 times more, right? Of course, surgeons got to be paid another $20,000, $30,000, or $50,000. So the total package here to get this device, think about a child who's deaf, right? The consequence of deafness is you're not going to develop normal language. If you cannot communicate with the hearing people, what are the chances of you landing a regular job, right? It's very difficult. On the other hand, if you think about a deaf person, intellectually, physically, they're just as good as you and I, right? The only problem, they couldn't hear. If we let them hear, well, they'll become instead of a social welfare recipient, they will be, significant contributor to the society. So that's very important, right? And so the Medicare only reimbursed $20,000 US to cochlear implant. So if our surgeon does one cochlear implant for a Medicare patient, hospital will lose money, don't get a markup. Surgeon will get a zero payment, right? So think about the potential market. Right now, the penetration rate for a cochlear implant or medical device like this in US, it's probably 10%. In China, India, Pakistan, Africa, East European countries, South America, it's less than 1%, right? So why? Because think about what pressure does, say, Colic Corporation is the largest manufacturing this business have. They're the star of the stock market, right? Their annual growth rate is about 30%, right? Their profit margin, they control about 70-80% of the market. They have high profit margin, and their PE ratio was as high as 75. Now it's far more like 20 or so, much higher than your normal business, right? There's no pressure for them to change that business model, right? What's the point of giving this, make this so accessible, everybody can benefit it? We can make 2 cents on each cochlear implant, right? Doesn't make a business sense dollar-wise for those guys, right? So I think for me, there's a social, economic aspect, right? And I think that's probably why, for those who see that change, remember 30 years ago when consumer electronics, right? Now how many, take TV for example. When I came to the States in the 80s from China, right? I still remember Magnavox, GE TVs, right? A lot of the TVs made here in the United States, right? You look at these days where TVs are made, right? They're not here, right? They're all overseas, right? But research-wise, development-wise, there's no better place than the United States. That's why the R&D center, I insisted, I said, it got to be Irvine, close to us and other centers of activity, where the activities are, right? I think that's the only way you can keep your technology competitive, right? So we just finished another $10 million second round funding, right? And I think this will keep us going for maybe another year or two. So we're maybe talking to, more investors, and hopefully, remember that later we have a huge, the marketing, as Winston Oh said, how do you market your thing? That's a totally different story. Now, so what we've done, right? So we have idea, right? Took me, almost 20 years to get where we are. So I'm very happy to see, this will benefit a lot of people. So that's sort of my experience with the first startup company. Right, it has its own life now. There's professional managers. I don't have to worry about anything, right? So I saw that's pretty busy, and that's what I'm going to do, and I did, right? Then about 3 years ago, maybe 4, the chair of ENT and also associate dean of school of medicine at UCSD, Dr. Terry Davidson, who is a surgeon, treating people with sleep apnea, right? And the standard treatment method is that negative pressure machine. You sleep with a huge machine, generating negative pressure, so your tongue will open up your airway, so you don't snore, and reduce the air flow to the brain, right? And so he said, well, can we somehow use another means, in this case, electric stimulation of nerves, hypoglossal nerve, controlling the muscle. So the muscle, changing the tongue muscle. So, when you go back to sleep, the muscle, you think about the tongue will just fall back. Maybe we can stimulate, increase the tone, and the muscle of what will contract, make the tongue tight, so you don't block your airway, right? And he said, well, I got a guy who's interested in putting some money, was a GNJ Vice President, and who has money. And he said, the question to you is, do you think we can do this? Electrically stimulate hypoglossal nerve, right? I said, I don't know about sleep apnea, but I sure know how to do electric stimulation. And I said, I don't have time, but what I can do, right? I know who you should talk to. Guess who I remember, hey, Advanced Bionics just let it go, a bunch of, I call it good guys, right? And one of them happens to be the guy, the vice president for their spinal cord stimulator, to treat the pain, Paul Meadows. And this is the connections you made 10 years ago. I know he was one of the persons who will let it go. I said, hey, Paul, there's a great opportunity. You want to come and to see if we can do it, right? And well, they hired him as the next thing you know, hired him as a vice president for research and development. And then I also remember I attended the meeting in Belgium, right? And they have, remember, different from the ear nerve. The hypoglossal nerve is the one right on the neck. The ear nerve is right inside the head, has a little bony house. Have a bone, you can put everything there. Here, it's a nerve, you have to really wrap around. It's a very different technology. But I recall a company in Belgium, Neurotech, they have an electrode like a cuff, right? That's my contribution, right, to that company. And so I said, well, here's a guy I find, and who knows how to do the engineering. Here's probably the company you should borrow the technology from, right? And now got a product in a year, and just finished the trial in both Belgium and Brazil, and shows a great reduction of sleep apnea episodes. And there's some oxygen level parameters for like 75% reduction. I think it's going to be very successful. And now the company is ready to file CE market approval first, right? And I'm on their scientific advisory board. I got a small portion of the equity of that company, but that's mostly not from you guys. It's from UCSD, right? Right. And so I said maybe I should just stop here. And then we got into see, I work with patients, right? And one of that's probably, I will say, also 3 or 4 years ago, we got a call from Nick Blevins at Stanford University. And Nick is a surgeon. He said, hey, Fang Yang, we got a patient who has who lost, the guy's a musician, lost his hearing suddenly on one ear, right? So he can hear okay with the other side, but this side, no hearing. But that was not the main problem. The main problem was that ear has a tinnitus. It's a ringing in the ear when there's no sound around. And that sound was so loud, non-stop, 24/7, right? And drove basically crazy. I mean, the guy lost his job, and depressed, whatever, right? And and Nick tried everything he could, from steroid treatment and the current standard, nothing seems to work. And as last resort, and Dr. Blevins said, how about give you a cochlear implant? Remember, the guy has normal hearing on the other side. He doesn't need that device to hear. But the idea was provide some input to his deaf ear and hopefully will balance, the brain. Well, work a little bit, not as good. That's why Nick called me. I'm the expert in cochlear implants. So can you do some special programming to this guy and see whether you can help him? Well, we spent 6 weeks working with him, tried everything we could. Nothing seems to work. Then out of luck, right? And one day we tried something very unique, and that sound seems to suppress the person's tinnitus. And I remember vividly, right? And the patient just said, leave me alone. Just let me enjoy that few minutes of silence, which I have lost in the last 2 years. Right? He just basically has tears in his eyes. Just say, let me enjoy a moment of silence. Right? Get out of the way. And that's help us, right? Start to say, well, we look at, wow, tinnitus. There's no treatment, and 17% of the general population has this problem. And you look at the veterans coming back from Iraq and Afghanistan. That's their #1 complaint. This is #1 service-related disability among veterans. And there's no cure, right? So I say, well, this is scientifically, it's a very interesting question, right? Technologically, it's very challenging, right? And we make a long story short, and then we have some protocols, algorithms, and sound, right? And the next thing I know, Ronnie sent the Allied Minds, the Allied Minds is a company, you guys, for those of you who are interested in, particularly like us, from professors or students trying to do a startup company. Allied Minds is a investing group specializing in transferring university-based research into a viable commercial product, right? And this time, the company we have is called SoundCure. I hope the portfolio page is here. They have about 15 or 14 companies. You can go ahead and find it. The SoundCure is listed at least. They have probably $300 million in their pocket. And I never thought. Remember, I told you the first time when we had to raise funds to do a Neurotron. Took me how long? Years, and talking to 50 people. I had one meeting with these guys, right? And they signed a non-disclosure. Take a look, right? And they did their due diligence work, checking out the field, state of the art, and our patent, right? The next thing I know, they're talking to tech transfer office, startup company. And one advantage, I'm working with these startup companies. Remember I said I'm a professor, I don't do the daily management operation, but I send my students to these companies. So, 2 of my PhD students, they're the main guys with SoundCure, and they just hired a general manager who is a veteran in medical device, and we're starting clinical trial, and they just put another $3 million into this startup company. And I think the hope is that they see the chance of success, right? And they also try to expand their service. We're trying not to cure tinnitus, but to treat other array of neurological disorders, right? I mean, that's a sort of a more or less, the kind of a personal experience I have starting up these companies. And I was telling GP so far, right? I don't know how much. We haven't made a penny revenue, but now there are a lot of people who are willing to put in more money, right, into these 3 companies. I think that's a very positive sign, right? And someday, hopefully, we'll be successful. Then everybody will benefit from this. Me personally, my students, my co-workers, university. But remember, back to the bottom line, right? It's the people you're trying to help. They can benefit from your invention, from your research. I think, to me, that's the most rewarding experience I've had. Right. Thank you for your attention. Yeah. We have a few minutes, so if any questions I can entertain, I'll be happy to. Yeah.
It's like, what's the minimum, like, non-disclosure you have people sign? Because what if they just go with your idea?
I'm very loose on that myself, right? Right. I think I know that a lot of the guys, they don't like. I mean, even some of my investors, they don't like that, right? Right. But personally, I think you got something unique. I mean, I think idea is important, but there's a lot more than just a single idea. I don't believe there's like somebody has such a brilliant idea that will kill everything in the market. No, it's not like that. I mean, remember the story I told you. I mean, why people who are invested in us? I think of course they like the general idea. Number one, there's market need, right? If there's no such need, forget about it, right? And I think the other thing is that if I look at something, I think I would say if this is a guy I want to work with, he better be the best in his field, right? I mean, is that single idea probably not, right? What kind of network does he have, right? I mean, for the field I'm in, I know people in both academia and industry, right? And that's very valuable, right? To start up a company. You think about it, right? Well, this is key opinion leaders, right? Eventually, you're going to convince those guys to adopt or accept, right, your product, right? And if I'm in a position that I can say, okay, if you want to do this, and I know who is the key guy you need to talk. I mean, the company need to talk to, if you wanted this to become successful, right? So I'm pretty loose. I just say, if anything we can tell people, let them out, so be it. Yeah, yeah. Yes.
Have you looked into developing a nonprofit subsidiary company and then going for foundation money to give it to those patients where you aren't going to get full money?
It's coming along, right? I mean, so first you have a product. Right now, say the Doctors Without Borders approached us for this kind of devices, and there's people from Dubai and from Mexico, a lot of private foundations. They will say, if you give me, because what they don't have is they don't have a suitable product in the market. Mm-hmm. If we have something, say $1,000, I mean, 5 times less, right? The Doctors Without Borders says, I'll go to Africa, I'll go to America, South America, I'll donate my time to do free surgery, but I have to have the right thing, a device in my hand. So I think, it's coming along. Mm-hmm. There's no question it's going to happen. I think this is sort of a new business model, right?
Any other questions?
Yes, please.
When you went to talk with your potential investors, you've obviously done this many, many times, did you go with a really well worked through profit and loss, a really well thought through spreadsheet showing the costs and the income and the total addressable market, the penetration rates and the cash flows? I mean, I normally find when I've done this in the past, I've been in the position that I've been in a few times now, I've always found that if I start with that and I figure out the physics, you immediately latch with your investors. They don't understand the science. You understand the science.
Right.
I do.
True.
But once they understand the shape of the money,
right,
and they can see their return on their investment and the day that they're going to start getting that income,
right,
then their eyes light up.
That's right. Yeah.
I was just wondering if you'd ever tried it the other way around.
What I found the most interesting is if they find that information
Yeah.
by themselves through the independent source,
Yes.
right?
So
You
they
tell
have
them
to-
what
they
you
have to
know,
verify it, that's right.
And then it's the guys that I found, we kind of like, well, the first battle, you have to have a feeling, this is something you're interested at
Yes.
all, right? And all the, just like all the investors, when they put that much money, they will hire people to do the work for them, and they will compare the notes, right? And the business proposal, I remember somebody asked that. I never wrote a set of detail. And I can write a very good scientific proposal, right? The business proposal, I told them up front, right? I mean, here's our experience. If you want to do this, right, you do the job, right? I mean, I don't want to run the business, right? So I've never written. I've seen many of them now, right? That is the detailed business proposal. But somebody got to do that, and we always
agree
look
with you. I
at.
never write the business plan. I just do the financials.
Yeah.
It's a one-page spreadsheet on a letter.
Yeah, I did that
It's-
part.
it's
Yeah, I
one
did
page,
that part.
One page.
Yeah.
And when they see the numbers and the cash flows and the returns,
Right.
then you've got them hooked.
Yeah.
Then you can tell them a little bit about the science and the excitement of the technology.
Right. Yeah, I think that there's a different models. I mean, I'm sure to achieve so-called success, right? And I think everybody's situation is very unique, right? And how do you utilize that your unique background and strength, for that matter? Right? I'm sure there are people who like your idea or your technology or your even or even the personality. I mean, at some levels, and I think. If you ask me now, so how do you form a partnership with somebody? I will say, it's not who give you the most money, and I will tell you. I mean, just say, do you get along? You feel with this particular guy, right? This is a close working relationship. That's even more important. It's not who gives you the most money, who you feel most comfortable to work with. Yeah, I think that's a very important lesson.
Okay, that's a very good closing note. And thank Professor Feng Genzheng again.
Thank you.